patients are paying over the last 10 years more than 60%. Deductible plans up over 200%. You pair this with a market opportunity where patient out-of-pocket costs are about $400 billion annually. When you think about the payment revenue that could be generated from that, over $13 billion, and you don't have to corner the entire market to be successful. Just 1% market share. This is a $130 million annualized revenue company. Greetings from PayGround HQ here outside of Phoenix, Arizona. Thank you, StartUpHealth, for putting this on, and everyone that's joined today and allowing me to talk to you how PayGround is changing the healthcare payments game. I first want to talk a little bit about recent headlines and movement in our space that will hopefully get you to turn up the volume a bit. You see here on the top right some headlines that you may be familiar with. You think about Cedar in the healthcare payment space and how they are now a unicorn. You think about the recent acquisitions by JP Morgan acquiring Instamed and VisitPay by R1. What's driving this is a couple things. One, the trends in healthcare. Patients are paying over the last 10 years more than 60%. Deductible plans up over 200%. You pair this with a market opportunity where patient out-of-pocket costs are about $400 billion annually. When you think about the payment revenue that could be generated from that, over $13 billion, and you don't have to corner the entire market to be successful. Just 1% market share. This is a $130 million annualized revenue company. So how to get started? It was driven by a couple of personal stories, good and bad. The bad is a picture of me there on the left. In 2018, I was diagnosed with testicular cancer. Thank God we caught it early. I'm 4 years cancer-free. And the much better story to tell is a picture of my family a few weeks after the cancer diagnosis, welcoming home our third kiddo, Augie. Between these two events, it triggered over 20 mailed paper statements. I say that you don't have to have cancer, have a baby to know paying your bills in America sucks in healthcare. So we had to log into various portals with different usernames and passwords. We were mailing checks in. We were calling and make payment over the phone. And I remember sitting at our kitchen counter with the bills stacked up, thinking, I just wish I could get my mobile app out and pay via Venmo or PayPal. And nothing like that exists in healthcare until today. My name is Drew Mercer. I'm co-founder, CEO at PayGround, the app that is available in iOS and Android stores today that allows us to fulfill our mission, which is to provide a simple solution for individuals and families to manage and pay all their healthcare bills in one place. Succinctly, how we get there is to be the digital wallet for healthcare. But we knew that we couldn't solve this problem just for the consumer. We had to also solve it for the provider. So we went to market first at the end of 2019 with a B2B cloud-based platform that allows providers to collect all their payments in one place. This could be at a small clinic, independent, or a large health system. But that includes point of sale payments, as well as a post-visit automated request engine driven by text, emails, and smart logic that can drop paper statements. The effect is we're increasing revenue for our users by over 20%. We're decreasing DSOs, day sales outstanding, by almost a week, and we're reducing paper costs by nearly 40%. When you think about our differentiation in the market, because there's other solutions that are doing the B2B side, but it really is the consumer solve that we do, and that is the ability and empowering the patients to pay all their providers in that one place, that one-to-many model. So patients download our app. They can pay any doctor, not just the doctors that have opted into the PayGround network. If the providers have not opted into our network, they're going to get a paper check that pushes them to payground.com to sign up to start getting digital deposits. And this is our product portfolio here from the B2B side. They sign up for free, they get direct deposits, and then my team internally is very good at upselling them to the merchant services option with PayGround Go, and then ultimately the whole suite at PayGround Pro, which is all that all-in-one bundle and automating payments, set it and forget it. I'd like to brag about my team for a minute. The best of the best in health tech. So my experience in GE Healthcare, leading business development at DaVita, and then most recently leading the commercial team at Experian Health, bringing the brightest over to Team PayGround. we have strong traction and we're just getting started. So we got 220 sites live. We got 7,000 consumers with their digital wallet loaded on PayGround, and we're venture backed. We are pre-Series A, so we're not raising money right this moment, but keep an eye on us because we'll be opening up our Series A later this year. We're all patients, so please download our app, give it a whirl, and please reach out with any questions, and I'll take a few now.
Awesome. Thanks, Drew. Great presentation. A question in the chat about your current customers. Can you share some of those?
Sure. So we started, as I mentioned, in the end of 2019, predominantly in the ambulatory market. We started with the independent market. That's where most of the the antiquation and less modernized tools are around rev cycle. And so that is where we started. And then as we matured the platform, we grew into larger physician groups led by ACO adoption, as well as now moving into the acute space. And we got our first handful of hospitals live.
Good question around insurance. How do you deal with all the layers and types of insurance?
Yeah, so at this point, PayGround is used by providers and patients. We haven't yet moved upstream into the payer space, although we do have some strategic initiatives behind the scenes in which we're headed that direction. But there is a trend in healthcare, if you talk to doctors and billing offices, where providers are getting reimbursed via virtual debit cards and not just ACH or check drops. And so with PayGround, we're able to collect those and also separate those from patient collections, allowing providers to better report and understand where their revenue is coming from payers versus patients.
A couple questions rolled in at the same time about competition. So if you could talk a little bit about the competitive landscape and what you're most excited about with PayGround versus your competition.
Yeah, I love that question. So I have, high respect for a lot of the solutions in the market. So just to name a few, I mentioned one up front, Cedar, Patient Co, formerly acquired or recently acquired by Waystar, Instamed I mentioned, and others. I see the question here around Square. We don't see Square too much in the space. We see some of that in the cosmetic space, just kind of the consumerization of healthcare. But we really compare ourselves with bringing that payment marketplace to healthcare. So providers and patients together to complete simplified financial transactions, and that's our biggest differentiation.
How long does it take you to get a site live?
Yeah, I love that question. So we, on the clinic side, we can get clients live in less than 3 business days. In the acute side, it gets a little bit more complicated, as everyone could imagine, but we get clients live as soon as 3 weeks. And we say, and this is a huge additional differentiation, is we're not looking to replace a current solution in the acute space. We can layer on top of a Cedar, we can layer on top of a R1 Flywire. We can literally just be that digital wallet and that payment option that providers are offering their patients to be able to pay with PayGround, similar to how we in the consumer world have an option in the online retail to pay with PayPal. That's the brand that we're building throughout healthcare.
Okay. Well, I can't move on without you answering this question because we can't leave people wondering, how do you make money?
So we have our revenue model is transaction based, right? So we do charge some subscription level costs, but I wouldn't say we're a traditional SaaS-based company. So we do charge for terminals on a lease basis, which does provide some recurring revenue, as well as our integrations to the various billing systems, practice management systems out there. But that fee, every dollar that's transacted through our platform, we charge a small percentage of that, and that includes the INA fees that you get from Visa, MasterCard, Amex, and others.